Hello everyone, welcome to the YouTube channel MEDICO'Z Factory. Today we are going to begin new subject important clinically. So we will start gynecology section with anatomy of pelvic organs. Kindly correlate the concept for better understanding. In case of doubt, use comment section and do subscribe the channel. So let's begin. So in this session, we will discuss anatomy of external genital organs. It is also called as vulva or pedendum. The vulva includes Mons Veneris, Labia Majora and Minora, Clitoris, Vestibule, and conventionally the perineum. As you can see in the figure, Mons Pubis here, Labia Majora is outer structure, and Labia Minora is inner side structure. Hymen, Clitoris, Urethra, Vaginal Opening, Perineum, and Anus. These all are visible on external examination. It is bounded anteriorly by Mons Pubis here and laterally by Labia Majora this side and posteriorly by perineum here. So let's understand each organ individually. First is Mons Pubis. It is the pad of subcutaneous adipose connective tissue lying in front of pubis and in adult female it is covered by the hair. So it is lined by fat tissue as you can see Mons Pubis. Next is Labia Majora. Vulva forms labia majora, which is bounded by skin and subcutaneous tissue. Medially forms posterior commissure in front of the anus. The inner surface of the labia majora are hairless. The labia majora are covered with squamous epithelium and contain sebaceous gland, sweat gland, and hair follicles. The adipose tissue is richly supplied by the venous plexus, which may produce hematoma, that is localized bleeding outside the blood vessels if injured during childbirth. The labia majora are homologous with the scrotum in the male. Next is labia minora. Labia minora is present internally on either side of labia majora and it doesn't contain fat. This is labia minora. Anteriorly forms clitoris to form prepuce and frenulum. Lower portion form fourche, which is fold of skin. It is injured during childbirth. Between the fourche and the vaginal orifice is the fossa navicularis. The labia minora do not contain hair follicle. The folds contain connective tissue, numerous sebaceous gland, erectile muscle fiber, and numerous vessels and nerve ending. It is homologous to ventral aspect of penis. Now next is clitoris. Here you can see clitoris. It is a small cylindrical erectile body measuring about 2.5 centimeter situated in the most anterior part of the vulva. It consists of glands, a body, and two crura. Glands is covered by squamous epithelium and richly supplied by the nerves. The vessels of the clitoris are connected with the vestibular bulb, which is injured during childbirth. Clitoris is an analog to the penis in the male. It is attached to the undersurface of the symphysis pubis by the suspensory ligament. Now next is vestibule. Here you can see vestibule. It is a triangular space bounded anteriorly by clitoris, posteriorly by fourchette and labia minus. There are four openings into the vestibule. Urethral opening, part of vestibule. The opening is situated in the middle, just in front of vaginal orifice, about 1 to 1.5 centimeter below the pubic arc. The paraurethral ducts open into the vestibule or urethral orifice. Now the next is vaginal orifice and hymen. The vaginal orifice lies in the posterior end of the vestibule. Do remember, in virgins and nulliparii, the opening is closed by the labia minora, but in paras, it may be exposed. It is incompletely closed by septum of mucous membrane called hymen, lined by stratified squamous epithelium. The hymen is usually ruptured at the consummation of marriage. During childbirth, hymen is injured and torn, and later result into the scar formation termed as carinculi mitiforms. Now Bartholin's gland. The Bartholin's gland are situated in the superficial perineal pouch, close to the posterior end of the vestibular bulb, lined by columnar epithelium. They are pea-sized of about 0.5 centimeter and yellowish white in color. During sexual excitement, it secretes abundant alkaline mucus, which helps in lubrication. Each gland has got a duct which measures about 2 centimeter and open into the vestibule. The Bartholin's gland correspond to the bulbourethral glands of male. Now next is vestibular bulbs. These are bilateral elongated masses of erectile tissue situated beneath the mucous membrane of the vestibule. Here you can see bulbs of vestibule. Each bulb lie on either side of the vaginal orifice in front of the Bartholin's gland. They are homologous to single bulb of the penis and corpus spongiosum in the male. They are likely to be injured during childbirth with brisk hemorrhage, that is, severe bleeding leading to hemorrhagic shock. Now next is blood supply of the vulva, arteries, branches of internal pudendal artery, and branches of femoral artery. And veins are internal pudendal vein, vesical or vaginal venous plexus, and long saphenous vein. And last, nerve supply of the vulva, bilateral spinal somatic nerves, ilioinguinal nerve, sternitofemoral nerve, posterior cutaneous nerve of thigh, and pudendal nerve. So this was all about basic introduction to anatomy of external genital organ of female. In upcoming section, we will discuss further topics in details. So do subscribe the channel for more such content. Thank you. Bye bye.